should be 3 to 5 times per week, and the patient should not experience fatigue. So if you experience, if let's say for example si patient pirmi siya gakakapoy, no, i-decrease lang ang frequency. So from let's say for example 5 times a week, himuon mo na lang 3 times a week si patient. Okay. So how long is exercise mo kay patient? Should be dapat 30 to 40 minutes of aerobic exercise. So I hope you still remember, no, your aerobic exercises sa TheraX. So, di ba, ang activity proper or ang aerobic exercise should be 30 to 40 minutes. And before your activity proper, there should be a 5 to 10 minutes of warm-up and then 5 to 10 minutes of cool-down. Okay? So, deconditioned patients need interval work with breaks every 5 minutes. So, for those, no, may mga deconditioned patient, so hindi siya mag-follow sa 5 to 10 minutes warm-up, tapos 30 to 40 minutes aerobic exercise, and then cool down. So, dapat mabalot-balot. So, pwede siyang warm up 5 to 10 minutes, ang pahuway, let's say for example 2 minutes, and then next naman, start ka sa mga light aerobic exercises, and then gradually pataas, and then cool down. So warm up is very important, no, for patients with CAD as with us, no, because it prepares the body. So it gradually increases the heart rate. So hindi siya dapat ang exercises nga abrupt. So gulpiada nga mataas ang heart rate mo, dapat amat-amat. Okay? So it gradually increases the VO2 max or the maximum oxygen uptake of your body, and allows the coronary arteries to vasodilate. So may time pa mag gradually react si coronary arteries. So what are the mode of exercises or the type of exercises that you can perform to the patient? So number 1, cardiorespiratory endurance activities. So these are mga jogging, ambulation, running, no, kung kaya na ni patient. And dapat maintained at a constant velocity. So, hindi siya dapat mag-increase. So, when let's say, for example, 2 meters per hour lang siya, so dira lang. Okay, excuse me guys, no? Mga chino. Next is your dynamic arm exercise. So, mga dynamic arm exercise are those with arm ergonometry. So, nakita nyo lang, do bike, pero sa kamot siya ginaubra. So this one induces higher heart rate and then blood pressure monitoring, no, due to use of smaller muscle mass. So mas siya, mas compared to your leg nga ergometer, wherein ang bike, no, ang tiil ang nagasikad. This one naman arm siya ya. So mas siya, mas budlay, kag mas maka-causes ang higher heart rate and blood pressure to your patient because ang naga-perform are smaller muscles as compared sa lower extremity nga mas dako ang mga muscle groups nga naga-perform. Okay? Next is your aerobic activities such as swimming and cross-country skiing. So this one naman, they are done by patients who are already in the mga community or phase 3 stages of cardiac rehabilitation, and usually those who do this are already they have the skill na in performing swimming, and those who perform cross-country skiing. And then of course, for patients who are high risk, hindi sila pwede sa competitive activities. What are these competitive activities? These are mga basketball, mga competitive dancing, so bawal na. Sa ila, especially kung low fit sila and they are symptomatic. So this is your arm ergometer. So this is your dynamic arm exercise. So usually ginatiman lang si patient, let's say for example 5 minutes nga, ma-arm ergometer lang siya. Next, no, is we can use your interval training during the beginning exercise and continues in later stages. So don't forget your warm-up, which is 5 to 10 minutes. So important yun guys ha, 5 to 10 minutes warm-up, and your cool-down is also 5 to 10 minutes. And then later in therapy, we can introduce your resistive exercises wherein we perform weight training. So this one, recent lang siya researches or may mga journal backups na siya na it's actually beneficial for the patient because before they believe nga kung mag-resistive exercises kasi kay patient nga nagka-cardiac problem, mas ano siya, mas tagaan mo sang problema si patient or mas ma-worsen pang kondisyon ni patient if you perform resistive exercises. Later, sa mga recent journals, they have found out it's actually very beneficial. However, there are some limitations. So, your resistive exercises are not allowed for patients who are, they have poor left ventricular function. They have ischemic changes during ETT. So, there is ST elevation or ST depression. Functional capacity, less than 6 mets. So, hindi niya kaya mag-perform mga 6 mets nga activities. Uncontrolled hypertension. So, nagagulpi lang shoot up niya BP. And arrhythmia. So, may arrhythmia si patient. And lastly, we can perform relaxation training. So, one of the best mga exercises pwede tayo perform kay patients. So, mga deep breathing, imagery techniques, what else? Massage, those are relaxation training. And usually, gina-perform niya siya sa mga cool down na phases. So, you can consider a reduction in exercise if the patient experiences acute illness or fever. Actually, some books would say na if there is a fever, contraindicated niya siya to any exercise because exercise can increase the body heat, no? So, ang internal temperature sang tao, pwede niya i-increase. So, if may fever na dan si patient, pa-exercise mo pa siya, maduga nga na gid lang tong iya fever. So, some would say, however, according kay O'Sullivan, reduction lang siya in exercise. So, acute injury or orthopedic complication, so, reduction man, there is a progression of the cardiac disease ni patient, may edema siya, weight gain or unstable angina, so pwede siya i-change ang frequency or duration of the exercise. The patient has an overindulgence with food, caffeine, or alcohol. And of course, environmental stressors. So, isa sa mga environmental stressors are the temperature. So let's say, for example, there is an increase in temperature. So let's say, for example, init di ang rehab, no? So, kung si patient may heart problem na nga daan, tapos ipa-exercise mo pa siya, so ma-increase iya nga body temperature, tapos init na nga dan sa rehab. So, there's a chance, nga magkaka-injury pa si patient because nag-increase ang body temperature na. Okay, so let's go to the rehabilitation proper. So, let's talk about your myocardial infarction. So, for phase 1, sa phase 1, you can see this one sa inpatient setting. So, when you say inpatient setting, so bago pa lang operahan si patient, okay, or bago lang siya na revive, okay, sa iyang myocardial injury. So, usually, your phase 1 would start 3 to 5 days for the uncomplicated MI. So, when we say uncomplicated MI, wala siya sang angina after the MI, and then no malignant arrhythmias or heart failure si patient. Okay? And then inpatient ni siya ha. So sa hospital-based. And then there should be an activity progression. Okay, so include nyo patient education and then hemodynamic and ECG monitoring. So mga hemodynamic monitoring are your heart rate, BP, what else? Ang mga blood works ni patient, so iyang mga CK, creatinine kinase nga mga blood works, your troponin I, okay? So dapat normal siya. Okay? And then you can get those values from the chart of the patient. So MI is a multi-system siya nga approach. So with cardiac rehabilitation, you get to work with a lot of healthcare team, members of the healthcare team. So for phase 1, your role as a physical therapist is to monitor the activity tolerance of the patient. So pila lang ang kaya ni patient ubrahon. Ano lang ang matolerate niya? Can the patient tolerate long sitting position? Can the patient tolerate raise ng iyang bed, ang iya bed, no, ang head niya. So also, you can prepare the patient for discharge. So pwede mo siya i-educate. So what are the expected activities niya when he goes out of the hospital? And of course, you have to educate patient to recognize adverse symptoms with activity. So usually hand in hand ka man ni sa iya nga PCP. So ang iya nga primary care physician would also educate him. But of course, augment ka lang sang nabalaan mo. Okay? And in terms of physical therapy, gid. Next is the support risk factor modification technique. So, pwede mo siya no itudloan sang what are the things na pwede niya obrahon no to decrease ang iyang risk factors. And then of course, provide emotional support. So part of our jobs as PT is to also empathize with the patient. And of course, you can collaborate with the healthcare team. So you get to talk with the nurse, you get to talk with the primary care physician, you get to talk with the mga medtech niya, no? So para holistic ang approach to rehabilitation ni patient. Of course, you're also expected to perform vital signs monitoring before, during, and after. So, important gid, no? So, and the most important vital signs are your HR and then your BP. So, these are very important gid. And butang mo na lang no para complete is your RR, your respiratory rate. So, for HR, dapat full 1 minute. For BP, so balaan nyo naman na dapat ang iyang cough saktuhan gid kay patient, no? If let's say for example si patient overweight, dako ang iyang arm circumference, you ask no sa nurse in charge or sa or sa iyang sa nurse station if they have a bigger cuff size for the patient. Okay? Para at least ang aton makuha nga values is accurate. So for phase 1, the RPE should be fairly light. Okay? So fairly light is 11. So amo na siya. Although for phase 1 no, lower than fairly light can be performed man kay patient. So mga 1 to 2 mets and heart rate increase of 10 to 20 BPM lang.